The Kunle Hassan Eye Foundation Academy anchors all the training and education within the group, and we are glad to be able to welcome you to this fourth lecture in the series of building and maintaining a sustainable eye care institution in sub-Saharan Africa. Today, Dr. Kunle Hassan will be focusing on the role of core values in shaping employee behavior for organizational effectiveness. Before we go into that, I'll just run through quickly the program, which is the format of today's presentation, how it will go, and then also share some quick house rules. If you can go to the next slide, please, to show the program. Yeah. So right now we're doing the welcome. Shortly, it will be the introduction of the speaker and then the presentation from Dr. Kunle Hassan. After that, we will have a question and answer session where people are able to ask questions or add comments to enrich the conversation. We ask that if you have any questions, kindly just type it into the chat box of the webinar, and we'll pick up all the questions or comments, and we'll be able to discuss, and Dr. Kunle Hassan will be able to answer them. Following that, we'll have the closing remarks. In terms of house rules, I think we just liked everybody to keep their microphones muted, so to limit distraction, and as much as possible as well, maybe turn your video off. And also just use the text box for your comments and questions. Now, to introduce the speaker, I'll call on Dr. Ayo Harriman. Dr. Ayo Harriman is the director of the Kunle Hassan Eye Foundation Academy. He will do a brief introduction of Dr. Kunle Hassan, and then we'll move on to the presentation from Dr. Kunle Hassan. Thank you very much and enjoy the session. Dr. Harriman, over to you.
Hello, Yemi. Thank you very much. Good evening, everyone. You're welcome to this fourth lecture in the series, Building and Maintaining a Sustainable Eye Care Institution in Sub-Saharan Africa. I'll just quickly introduce our speaker, Dr. Kunle Hassan. Just a minute. Let me just get onto the right page. Okay, who is the Chief Medical Director of the Eye Foundation Hospital Group? He's an internationally recognized consultant ophthalmic surgeon with a wide experience and specialization in vitreoretinal, glaucoma, anterior segment cataract, and oculoplastic surgery. He's the recipient of several lifetime achievements and excellent awards, and is the first Nigerian and African to be honored with the International Council of Ophthalmology MAC TSO Golden Apple Award, which is presented to leaders in international ophthalmology for demonstrated innovation or exceptional achievements in ophthalmic education. He has over 120 publications to his name and more than 90 academic, professional, and society awards for his contribution to different spheres of life. And in ophthalmology, he has held and still holds some of the following positions. He's been an advocacy coordinator for Africa in the International Council of Ophthalmology. He's been a council member of the International Agency for the Prevention of Blindness. He was a one-time president of the Africa Ophthalmological Council. He's a board member, he was a board member of the International Council of Ophthalmology and president of the Ophthalmological Society of Nigeria. He has played and still plays an active role in the corporate world. He has extensive corporate, executive, and non-executive boardroom roles in healthcare, finance, and the microfinance sectors. He's been a board member of Diamond Bank, which is now Access PLC. He was a one-time chairman of the Governance and Personal Committee, Diamond Bank PLC, and this was during his 10 years of service between 2006 to 2016. He's been a board member also of the Audit and Risk Management Committee of the Diamond Bank, now Access Bank PLC. He's currently the chairman of Health Partners Limited, of the Deseret International Hospitals Limited. He's also chairman of Summit Healthcare Hospitals Limited. He's executive chairman of the Liahon Economic Development Foundation, which is a microfinance business. He was recently appointed as the chairman, the board of management, Onobisi Onobanjo University Teaching Hospital in Ogun State of Nigeria. This was in 2020, he's still the board chairman. And through the I Foundation Hospital Group, he has created a robust and sustainable infrastructure to drive his vision to eliminate avoidable blindness in Nigeria and sub-Saharan Africa. The institutions he founded continue to set standards for quality eye care and public-private partnerships for eye care in Nigeria. So he is giving this series of 10 lectures on building and maintaining a sustainable eye care institution in sub-Saharan Africa. It's not only this is not only for eye care institutions, but all healthcare institutions. The first lecture was using the Eye Foundation Hospital Group in Nigeria as a case study. The second lecture was meeting the challenges of a startup in ophthalmology practice. The third lecture was building a crisis-resistant culture in an ophthalmic institution amidst a disruptive VUCA environment. VUCA meaning a volatile, uncertain, complex, and ambiguous environment. Today, he's going to speak about the role of core values in shaping employee behavior for organizational effectiveness. So good afternoon, Dr. Hassan. We're ready to listen to what you have to teach us this afternoon. Thank you.
Thank you very much, Dr. Harriman, for that kind words. And I would like to thank all the participants for creating time to share experience and to listen to what I have to say about building up our foundation. Today's topic is on roles of core values in shaping employees' behavior for organizational effectiveness. This comes out of experience. I mean, when we started Eye Foundation, I think we're not more than 6 or 8 staffs. And when you start such a small organization at the beginning, it's more or less like a small family. You tend to know each other. You tend to rub on each other and improve on the ethics and the organizational codes, and things move on. But with time, as the institution develops from a staff of about 6 to 8 to over 200 staffs, you start seeing a lot of dilution factor. Sometimes you don't even know some of your staff who are in different hospitals. However, the management do organize from time to time management lectures, integrating ideas, and trying to keep the culture of the organization on. But usually, to our surprise, the dilution factor is so high, and especially with about 20 to 25 to 30% attrition rate is acceptable in the healthcare industry. And as those who have been in the organization move out of the system and new ones are coming in, this impact of the values of the organization is diluted more and more. And you start seeing a lot of complaints from patients, complaints from also within because people bring in their culture from where they were coming into that organization. I think this was palpable within our organization, and especially in a sensitive environment like Nigeria, where patients tend to personalize their relationship with the doctors and expect a standard they're used to. As we grow, we had the human resources department became more active, and we are forced to recruit professionals who can guide our future in terms of human resources coordination and meeting statutory requirements, and also fashioning a way to bring things into focus that will improve the value of the organization. In 2019, we decided the Human Resources Department directed and decided to bring all these ideas, all the efforts that have been put in places to coordinate values in all our, then we had about 7 branches. And we had a series of meetings, both at management level, senior executive, and also a mixture of aggregates of different levels within the organization to formulate our core values and try to make it more prominent and try to make sure it guides every meeting and the culture of the organization. Let's see, what is core value? I mean, core values are the root beliefs that a person or organization operates from. You must have some fundamental beliefs, and they are principles, perspectives that guide a person's organizational behavior with others. So we had a series of sessions and tried to define what should be the I Foundation Hospital Group core values. We believe this is very important because our reputation depends upon it. And we must come out with something that makes a difference, and those values that makes our practice and the result of our interrelationship with patients, with ourselves, and the outer world palpable and effective. So following a series of these brain sessions and discussions, which we took out of the hospital in order to have good time to deliberate on them, we came up with 6 core values. And these are foundation core values are the principles and beliefs that depict what the organization stands for. The integration and acceptance of the core values became a priority to drive overarching goals and priorities of the organization. And we more or less make it mandatory for every members of our institution to learn by heart the mission and the vision statement of the hospital, and also recite or discuss important part. Recite was the core value, and an important part of each section of the core value being discussed at meetings, especially at the annual and monthly management meetings, so that it becomes part of the culture. People can read, can learn by heart, and can be asked at any time what our core values are. And this works because we start seeing the impact in our relationship within the institution. The core values are also aimed at providing clear direction to staff members, empowering them to make right choices in the discharge of responsibilities, so that we have parameters that guides how we relate within ourselves, within the organization, and how we relate to our patients, and how we relate even people outside our institution. So adopting the core values promoted greater ownership and business success. It enables the staff to take ownership of the process and be able to digest and reflect in their countenance and behaviors what that core value stands for. So the core value are depicted by a delightful acronyms. We put them together and therefore find an acronym that is simple for all of us to remember. And we came up with the idea, we are free, that is, are free. So to everybody in our foundation, when we say are free, it means something to all of us. And these are free. The A stands for accountability, a willingness to accept responsibility for our own actions. Accountability is essential in any organization. People are bound to make mistakes. People are bound to have different learning curves. And people from different backgrounds do behave to situations differently. But through this convoy, we are able to train and imbibe the discipline, at least in most of our staff, to be responsible for their actions. We can have a project, we can have a program, people can commit error, mistakes can happen. You must own up to it. It's not unusual in an organization for people to cover up mistakes. And once that is covered up, then it becomes a chain of reaction. Many people are guilty of that, and then people move on to a dishonest behavior. But once people are made to be accountable for the action, positive or negative, and if it's negative, we all show understanding. You go through the process of correction, even if there's reason for punitive sanction, it is done. And the person that committed mistake will be better off because they learn from it. And from there, wherever they go, or even their own personal life, they learn to be accountable and take responsibility for their actions. So it's key, answerable for whatever responsibility given to each of us is very key. And that is important from the domestic staff who are responsible for cleaning the hospital to the chief medical director along the group. Everybody must reflect that personality in their ways of dealing with in their daily endeavor. It took us quite a while. They'll be resistant in any sort of program, but with time, with a good management, with a more robust interaction with the staffs, we're able at least make sure because everybody moves their microphone, please. We're able to at least raise the standard of awareness and gradually majority of the staff embracing that. The second, which is R, stands for resourcefulness. Resourcefulness here is the ability to find quick and clever ways to overcome difficulties. I mean, in any organization, there are challenges. You can never have enough. There'll be competitive interests and competitive services such that you might skew your interests or expenses or material towards a specific goal. But however, the people delivering the service and the whole organization must be able to think outside the box, must be able to meet situation, adapt to situation, and meet the situational needs by using what is available to deliver a better service and get the best out of it. It's not unusual for staff, you ask them, oh, this is not my responsibility. You ask the other one, oh, so. But in an organization where people are polyvalent, you train your people to be able to multitask and to be able to use the available resources, both human, financial, across the board demand of the organization to yield a better result. This always affects the bottom line. If you have the culture to be frugal, to make sure that you get what is necessary to give the best and not to create a wasteful atmosphere within the organization, your bottom line will be better off. And when the bottom line of the organization is better off, it affects everybody. That means you have a profit margin in your work creation that can take care of other things, which include the welfare of the staffs. So the staff must understand that whatever we're doing is in the best interest of all of us, because service rendered, financial incentives, and other things that goes with it in terms of compensation to that depends on the bottom line. If you do not manage your resources very well, other human resources, financial, relationships, social, all must be balanced and well managed. Often at times in organization, when there's an increase in responsibility or provision of a new service, people always ask for new staffs. They always think, oh, we need more staff to do this. We need more staff to do that, which is which may not be necessary in most cases. People within the organization must be able to adapt and take over those responsibility in order to save cost and also in order to be efficient. And that's why a very good HR department is important, to imbibe the discipline of leaders and responsible members of the team to be able to give a fair evaluation of performance evaluation of those that works under them. When there's a good performance evaluation and hard working is rewarded, the organization is likely to develop a culture of making best use of the resources available to them, not just asking for more because they feel the resources are there. And sometimes most people in organization, especially the doctors, the nurses, they do not understand what's going on behind the scene. They do not understand. They only see income. They are not seeing the expenses. They are not seeing the impact of the economy, foreign exchange, risk, and not devaluation on the organization. It is the management that is looking and balancing the books and seeing how resources can be utilized in a very prudent way to be able to deliver the same service. People go to operating room or to clinic, they just use materials without consideration for replacement or without even saying what is the value, what is the monetary value of that thing. But the management owed them the responsibility of enlightening them and making them aware of the cost. And this is where in our own organization, every month, we have a management meeting where we have an holistic view about this, what we're generating, where the resources are coming from, which of our services are the cash providing we can classify the cash cow, and which services are we providing just to augment the system, but we are making a loss. So understanding how to handle this so that there's a balance within the system and creating a positive impact in terms of financial profit. That's what drives the organization, because staffs have to get their salary. If staffs don't get their salary, I'm sure you see a lot of them leaving the system, but they must be responsible for creating that wealth before they share the wealth. And the only way you can do that is to make them aware of all those behind the scene financial juggling and the importance of using the resources prudently and effectively, so that at the end of the day, there could be a positive impact. The E in the acronyms for our own core value stand for ethics. Moral principles that governs a person's behavior or the conducting of an activity is based on ethics. We as professionals, as doctors, there are many medical ethics we must know. There are things we do not do. We deal with patients who trusted us with their confidentialities and give us an insight into their life. All those things call for maturity and ability to deal with those information and see it as a privilege and protect those information from getting to the outside. It's not unusual you get to clinics and you have, especially in eye clinics, we have people who are diabetic, who are hypertensive and all this. And on the case note, there might be stickers or signs or things that shows that this patient is hypertensive, this patient is diabetic, this patient is allergic to this, and it's on the case note. It's not unusual that you can see people putting that case note where people can see it and read it and knows about the condition of that patient. So there's need for a lot of training, ethical training, to ensure that even the staffs, medical records, even the junior staff must be able to be aware of what is expected from medical practice. So it's not just the doctors or the nurses or the eye who are liable for maintaining the ethical practice required of an organization. People down the line must be aware of that. And part of the way to ensure this within an organization is through your core values, is through teaching them, not only teaching, but also supervising and ensuring that this is done. And when there's an infraction, appropriate action is taken to ensure that staff keep to this. So the moral principles based on ethics is very essential. The F in our core values stands for flexibility. Flexibility is the ability to change, bend, malleable, to adapt to situations. Flexibility in medical practice is very important. It's true we have designated responsibility, job description for different people. But you will not pass by and see a patient that needs assistance or that needs support, and because you are not a doctor or you are not designated to be able to be responsible for that patient, you will just pass by. No. We have to be adaptable to provide support anytime we need it to that patient. We must be flexible enough to expand our role beyond the one that we're expected to do. A good example, I remember when we started training and we're short of staffs, sometimes we're short of nurses or people to stay overnight with our patients. It's not unusual then for even people who are not nurses would desire to stay overnight in order to look after the patient. Though there be a nurse there, but the nurse might be stretched. You need some other support staffs. And at that critical time, there might be no enough support staff. Your staff must be flexible enough, at least to play a role. Even if they can't pay a direct nursing role, they can play a support role. And when the need arises, it's not a matter, it's not my job, it's not my responsibility, it's not this. You must see yourself as having a common goal and know that you owe it to the organization and to yourself and the patient to be able to be flexible in providing solutions. Not just at clinical level alone. I mean, in management, in finance, and other areas that drive the organization, we often see this. There are cases where we have to meet targets in terms of meeting auditing reports or submitting information that are necessary, and staffs have to stay behind in order to finish that job. And staffs who are not even in that department that provide support service may have to be flexible enough to give necessary support in order to achieve that goal. So flexibility is key. I, as a medical director, if I get to somewhere, even to the level that I see a place I think it's not proper, I go into a restroom, it's dirty or something like that, I immediately take that responsibility. I won't say, oh, I'm a chief medical director, oh, I can't do this. You immediately see yourself doing what others can do, however low or higher they are in the hierarchy of the organization. If I get to an office, it's dirty, I won't say, I'm not going to work here. Immediately before I call my patients, there must be a reason why this is done. I first of all solve the solution, get a place organized and do things. And then after that, we can then have a meeting and see why there's that gap in the system. So flexibility cut across many aspects of the organizations and responsibilities. So basically, what it means is ability to work under any condition and adapt, create adaptability, and make sure that what's to be done is done, irrespective of your level, irrespective of your time, in terms of either you finish your work for today or that. No, you do things across the board in such a flexible way that at the end of the day, the patients that you're serving or all the people that you're serving that are not even patient but important to the organizations get results that is desired. And usually these sort of things is noticed and people are compensated. And that is why performance evaluation is very important when it comes to compensation of your staff. There's some that will go extra miles to do things. And there's some, it's an organization that will only do what it calls give a face value to things. And we do it when they know that there are superior people there. And there are those who will do it irrespective of anybody who's there, even when they're not watching. So there must be a way where the human resources and the senior management can critically analyze the organization and also analyze themselves in terms of contribution to the organization through flexibility. The fifth word in the acronym, which is RE, is respective engagement. That carries two elements there. Respect denotes courtesy, having respect for people across the board. Engaging people in whatever form, either they're visiting your hospital or you are doing a service, you are performing a service, whatever you're doing, you must respect those people. Even the poor, since we do a social enterprise system, and we have the bottom of the pyramid as focus of operation in some of our institutions, even those poor people that we are serving must be respected. I always make it clear to my colleagues that without them, we have no institution. They are not doing us a favor, even when we are giving free service, because they are the core source of skill transfer. The residents, even the senior doctors, you are learning a new skill. These are the critical people who are critical to your skill transfer and to the credibility of your organization. So they must be treated the way you treat somebody who is paying. The level of environment to which you operate might differ. Those are luxury plus, but the fundamentals are the same. You must engage them respectfully. You must see to their welfare. You must treat them with dignity. And that is a culture within the organization. This is very important, because if they decide to say, no, I'm not coming there, and you have less patients walking into the organization for surgery, for service takeover, definitely the organization will go down. A good example is Ijebu, where almost 60% of the surgeries are free or sponsored at a very low level, and where we count on walking patient into a service, apart from the ones we go into the community to, screen them and bring them in on charity basis. Also, it's important that those that are walking on their own into the institution to have their eye care and also tap into our services. That's an indication of the impact. People can have free surgery, go back into the community. Those who can afford a little will walk into the hospital and increase the number of patients. And with that, the number of, our revenue will also go up in order to create a sustainable. Nothing is free, somebody is paying. So even those who are doing free, the other that are paying higher premium for other type of services are subsidizing those ones. So it's very important that we respectively engage all our patients, and not just patients alone. Even within the organization, we must respectively engage ourselves. It is not acceptable for any senior colleague or anybody who have edge over the other to talk down on their subordinates. The subordinates might not react, but definitely it affects the morale of that subordinates. And this can be passed on to their colleagues. And since everybody have a place within the cascade of staffs, it will definitely affect them. And it's important that is when you respectively engage those staffs that works with you, you will get to know more about them, and they get to go extra miles in terms of delivering services and providing a way for you to be able to manage them and see them as colleagues, not just as subordinates. And respect, you must earn their respect. You do not demand respect from subordinates or junior staffs. You earn it. And if you teach them to earn, how to earn respect, they also will know how to earn respect from those that are below them. And it becomes a culture within the organization. You can correct people and have a more positive impact by correcting them in such a way that do not demean them or make them feel that they are worthless within the organization. If not, if you are not helping some of those junior ones to grow, you watch them go because they will not have confidence in the system and they will not be emotionally balanced in order to give their best to the organization. So there's this important respective engagement, especially in a society. A lot of us are exposed to international cultures where we call our father's first name or senior brother call his first name. It's not in a culture. The culture goes along with respect. And we must not imbibe that discipline feeling that, it's a Western world. No. That is what is killing Africa. Africans have values, but we've been brainwashed to see that whatever we do is inferior and that whatever the white guy is doing is superior. In that way, we're enslaved forever, irrespective of what's going on. This COVID-19 issue is very important. Suddenly, all those who can fly abroad, those who have the jet suddenly cannot, as they started looking within for medical treatment. And to some of them, it's an eye-opener when they discover the standard of practice in different disciplines that affect possible in this country. And they then tap those things and see the difference. But anything in Nigeria, you said, they believe, even Nigerians outside the country, believe that there's nothing good within. So all this affects us, affects generation to come. And I think we should embrace that culture. We should expand it. We should cherish it and carry it on. And know that we earn respect, we pass it on, and we appreciate what we have. The last part of our core value is empathy. And empathy is the ability to understand and share the feelings of another. We must be able to understand and share the feelings of another. A good leader in an organization will notice if any member of his or her group sort of behave differently. And that leader should be sensitive enough and have a high emotional intelligence enough to take interest, to be able to ask in a respectful way without demanding why that change, either in the look or personality of members of this group. When you show that, definitely he'll be able to relate to you, have the confidence, and share their feelings and what is bothering them with you. When that is going on in any organization, there's a good empathy. It promotes a healthy rivalry. It promotes an insight into the emotional intelligence of those in your group and how best to deal with them. There are usually three types of empathy. There's the cognitive one, and the cognitive one helps you to look at other people, feel what they're feeling, and how to get them to relate to you and help to provide a solution. And there's the emotional one, when you feel you are providing sort of support for somebody and you're able to understand their thoughts and their emotion, and you're able to help them through that emotional phase and help to provide solution. That goes with providing love, to care for them and to get them out of that problem and become more trusting towards you in what you do. And there's the compassionate one, which definitely you understand the person's predicament, you feel it with them, and you help to provide solution. So empathy can come in different ways. There can be a detached one, but which you help to find a solution to support, and the person help the person to move on. And there is the emotional one, where you have to feel what that person is going through. You feel it, and what they're feeling, and therefore be able to relate to them and help them to go through and help themselves. And then there's the compassionate one, whereby a person's predicament, you can feel, understand the person's predicament and feel with them and help them to find a solution. So some are detached, some are interwoven, and some you got to see to the end. Whichever the individual or member of your staff in your institution falls into, providing any of this support can make a lot of difference. Now, as medical professionals, the same must go to the patients. You can show empathy and be a bit detached. You can show empathy and share the responsibility towards them one way or the other in a balanced way. And you can show empathy by being compassionate and see them through. I will share an experience with you of recent. There was a woman with very poor vision in one eye, about 660, and has been hanging on for years not to do the cataract in the other eye. And when she came to us, we look at it and ensure her that, okay, you'll be all right. And we did the surgery. And good enough, she had a 20/20 vision the following morning. She was so happy and was full of praise and everything. She paid good money for that service, and the husband was prepared to do that. And she enjoyed it. Suddenly we saw her just about 8 weeks after her surgery. She came to clinic. She fell at home and banged her head, and she couldn't see anymore. On the examination, she's got prolapse iris, she got ifema, scan shows a lot of hemorrhage behind. And the husband was there are only two of them together with their domestics. The husband was so worried. And when we look at this patient, said, okay, good enough. There's a vitreoretinal surgeon operating. We send you, you have to go upstairs, we have to admit you, see what we can see to repair the wound, and then see what we can do to salvage and see at least what the end result will be. When we look at the cost to get this patient back, to save it to retina, this thing, it's running to thousands of, it doesn't come cheap. And the man just, you look at the man there and just say, I don't have this money right now to do that. And what? I told the man, fine, that's fine. I mean, the nurses were very good. They were not pushing everybody, but this woman cannot go back home. And I stick out my neck. I said, okay, man, no problem. We take you in, we do all the surgery, and then we give you a bill. You can find time to pay the bill. And she went in. It was the surgery we discovered that even the lens inside the eye is gone out. Everything, he had choroidal hemorrhage, he had everything. But we were able to salvage that eye. Though the following day, he could see hand movement. We didn't put another implant until he must have a secondary surgery. You know, that sort of situation, you have to take the interest of your patient first. Your institution, your practice does not go down. Imagine if that patient says, oh, no, you can, well, mama, no problem. Go and look for the money, you come back. We all know as ophthalmologists that by the time that patient is back, there'll be end of termitis, there'll be also the eye will be salvaged. How, at the end of the day, even if the eye cannot be saved, even the damage is severe, but the fact that we were there to empathize with them, to provide, show compassion, and go to the extent of doing this thing under general anesthesia to get the best result, even if that patient at the end of the day, due to damage, is not going to see with that eye, she will always be grateful and will be part of that solution. And if the patient can see, she will always be grateful for giving that solution. The husband phoned me 2 days after to thank me and the staff and said that she's waiting for a kid overseas to get the money ready. And I said, fine, no problem. Take your time. It will not be too much on compassionate ground that if this patient, after the surgery, he can't, I mean, the eye should go blind, and you know this sort of complication, to write off such a bill and take it as your contribution towards allaying the suffering of this patient. Because it goes beyond just losing a sight. She will become more dependent. She will need a lot of other supports. And that money they paid into the institution can help to stabilize. I'm not saying that you should do this as a standard, but you study your patients, you look at them, you should be able to discern which patient is in distress and cannot afford this, and which patient they can afford. This is part of the thing we should always think of. Because all these core values, they're the one that determine your reputation. They're the one that determine how they see you and how they interpret what the institution stands for. So it gets to a level where you build an institution, and that institution will be able to balance responsibility and commitment not only to society, but seeing life in a more spiritual way that creates a balance that makes people feel that that institution have served mankind and also have been successful in financial times and be able to keep standard. So, in summary, the essence of these core values is to integrate all the staffs, is to guide us and to be able to set priorities and goals, and be able to see how we demonstrate a balanced emotional intelligence and other factors to run the organization successfully, at the same time have a human face and have a standard. And that gold standard is what we attract more people into the institution. And that standard is also what to make the staff feels that they feel fulfilled and make a difference between them. An organization where there's not such guidelines towards taking reputation as a key factor in determining the success of that organization. So when these are in place, all these values have impacts on the employees, their behavior, their understanding and attitude towards life, not only to the people, clients within the organizations, patients and other, but also to the outside world. And it affects their character. And it's that character and what you've taught them, what they gain within the organization when they're coming, even when they're leaving, they carry it into the future and also affects into their families and into the society at large. And that gives you a social impact that your institution should be proud of. So this is the impact of core value in our organization. We keep repeating it. We keep learning about it. We keep putting it into practice until we get to perfection. But we will not get to perfection in a day or years, but we know that at least we're in the process, and more than 75% of our activities are guided by this. And as there be more attrition and more dilution factor, it's being repeated to the new intakes, it's being repeated to people, and it's becoming a way of life. And when values become a way of life, it's more easier to live and to interpret. And surely we have more impact, positive part on the individuals within this institution, on the institution as a whole, and also on the society that that institution is serving. Thank you very much for listening to me, and I look forward to our next lecture, the first Saturday of July. Thank you.
Thank you very much, sir. Thank you very much for this does anybody have any questions? Please post your questions in the chat box. Or share your comment. I can see Olutsala Onobola with I don't know about it. Okay, there's Dr. Ganesh here, who says excellent presentation. Thank you, Dr. Ganesh. And Ibube says very excellent and informative lecture. We've talked about core values today, the importance of core values, which Dr. Hassan summarized. And on your screen, you can see what the Eye Foundation Hospital group. What their core values are: accountability, resourcefulness, ethics, flexibility, respectful engagement, and empathy. I'm showing different values. And once it is repeated, staff are encouraged to memorize them. I think somebody can hear some sound. Thank you, Dr.
I get that the chat is muted.
Okay, we have a question from Sam. Oh, I can hear. So can you hear me?
Yeah, sorry, Dr. Iron, if I can just come in, we can hear you. I think there's a comment from Dr. Fowle that it seems that the chat is muted. It sounds like people are having problem typing their chats in. We're still getting some chats coming in. So perhaps while we take on the question from Sam to Dr. Hassan, I will ask that if anybody has a comment, kindly just raise your hand. I will try and find you. I'll be able to see whether you can just if you're having problems typing in, whether you're able to at least say your comment or ask your question. So please kindly raise your hand and I will call you. But meanwhile, there's a question for Dr. Hassan from Sam, which is how do you get your work colleagues to feel a sense of ownership in their activities?
Right. How do you get to, yeah. That's a very good question. I hope you can hear me.
Yes, sir.
Yeah, that's a very good question. Getting your colleagues to have a sense of ownership in the activities is something you must build in from the beginning. From the beginning, when Eye Foundation was started, I was privileged to be the first, and I was privileged to be the founder, and also I've met a lot of people that mentored me, and I relate to. I'm happy Dr. Fowle is around. She's one of those one that has an enormous impact on my perception of what to do as an ophthalmology, and also in terms of moving from visual retina to moving to the world of real ophthalmology to help the needy and the poor. We, from the beginning, applied my exit strategy. I knew that I would not be there forever, and therefore was able to get in young guys as residents that shared my vision and believed, despite the fact that we were not sure where we were going in the terrain, they share that vision. So sharing that vision and being together, owning the vision, create that sort of ownership from them from the beginning. That we are in it together. Whatever we do, whatever we see, however we project this, we're taking the risk together. And we are just about 10. Today, Dr. Okonkwo, Darinlo, Oguru, and all the younger ones we started then. I will say that, but we believe in what we're doing. A lot of people didn't believe in us, but there's some that believed in us. They see a vision. Like Dr. Fowles, I'm happy she'll be smiling today that that's part of our reward. Using our word, I always remember, it doesn't matter who gets the glory as long as the work gets done. She taught others philosophy, and we embrace it. Doesn't matter who gets the glory, get the work done. And I always tell them, we don't have to be intimate friends to work together. We all have to share. We have to share a common goal and go for it. That sort of fundamental philosophy, transfer the ownership to your colleagues if they believe in it and they work with it. And that's why quite some of them are shareholders in the organization. Some who are young are still aspiring to be part of it and take it to greater heights. So it's the philosophy and what you practice that really creates that ownership. And once you have that, things will move on. I'm not there. Today, I don't do even 1% of what goes on in our foundation. But there are people who share these core values, who share their vision, and they keep going on. That's my own understanding of answering your question. Well, I think, thank you.
Thank you, Dr. Hassan. The other questions are coming in now. From Olubenga Success.
Dr. Far's hand is on.
Yeah, she's been able to type a question as well. So, okay, maybe, Doctor, I have a question here. Dr. Falma, I will read your question, Ma. If you still have something else to say, then please, I'll call you after that. Dr. Benga's success question is, should an organization set our core values and then work to follow them? Or should the organization check what they are good at and set core values to reflect them?
I think, yeah, are you okay?
Yes, did you get the question, sir?
Yeah, should the organization, can you say it? Okay.
Okay, should an organization set our core values and then work to follow them? Or should they check what they are good at and set the core values to reflect them?
I think they should set their core values themselves. They should make it, all of them should get together, look within, look at this, do a SWOT analysis of the organization, the strengths, the weaknesses, and what the ideal should be. And once they can do that sort of SWOT analysis, they'll be able to identify the gaps. And then they should now have a holistic view and create a core value that works towards that ideal. And then run with it.
Thank you, sir. Now I'll take Dr. Fal's question here. Dr. Fal says, residents and other trainees are assessed on character and learning, and I believe this lecture is on the character aspect. How do you insert this systematically into training, both in the content and assessment?
Yes, I quite agree with Dr. Fal's statement, and we are aware of that. And especially we practice that right away from when we are taking the residents in. They have their standard examinations, all these things, they fulfill the, but before we take them in, we have questions that will reflect their character. And part of the exams also contains questions that when they answer those questions, you can see behind the scene where they're coming from. And even during the interview, that's why physical interview is very important. The body language sometimes gives some of them away. As I always mention to my colleagues, that it takes more than intelligence to succeed in life. Character is important, very important. It's the way you deal with people. All these they determine your success in life. So we have brilliant guys who will never make it to the top because of their attitude, because of other things. And some of them are formed by the time they're coming to residency. Some are still malleable, you can see they can learn. And some are there, to see themselves through, give themselves the opportunity to change. Not only at residency level, even as you are training on, they will see more of their characters. And that's why in our institution, just passing your fellowship do not make you a consultant. And passing your fellowship in our institution doesn't mean we're going to keep you as part of our staff. The part of the evaluation, the performance evaluation, there's a huge gap there on written laws about characters. And the HR will look into this. And even after passing your fellowship, we have our own group practice, which we call the Associated Consultants, which is a privilege after 2 years that you are admitted into this group. Character is one of the key things because we have rules. If you are in a practice, you cannot go and practice somewhere else. There are rules of engagement and disengagement. So all these, we make sure we are measuring the impact of character in all the people that go along the ascending line in our organizations. So it's very key. And that is why in our organization, doctors that rarely leave our organizations when they key in, those who left either we asked to go or do not fulfill that character element, which is important for the success of the organization. And your character also affects your learning. If you're teachable, if you're humble, you'll be able to assess a greater aspect of your aspiration through your relationship with your seniors and how they pass skill down to you. So accessibility in terms of learning, in terms of achievement, is also guided by character. Thank you.
Thank you, Dr. Hassan. Dr. Farmer, are you able to unmute yourself if you would like to say one or two things in addition to your question, ma? I think you have to unmute yourself at your end, ma. Okay, while we wait for Dr. Fao, okay, sorry, ma. It's the functionality has to happen at that end. We think it's a technical glitch on our end for us to be able to unmute others. So, are there any other questions or any comments, additional comments, please? Kindly type it out. We have another one that's just come through. I think it's a comment from Mr. Dele Salami, which says the core driver of culture change is leadership. The success of the EFH story is largely due to Dr. Kunle Hassan's ability to relentlessly walk the talk. Let us all strive to lead by example. Thank you so much, Mr. Salami, for that as well. Just checking to be sure there are no other questions or we've missed any feedback. Florence Nkwogu said, very informative as usual. Thank you so much, Dr. Hassan, for your magnanimity. Emitope Oshiyoku, thank you for your lecture, sir. Ebube Chukura, very excellent and informative lecture, Dr. Hassan. Thank you. I think we've taken all the comments and questions, Dr. Hassan. Thank you so much again for sharing the lesson and for letting us be part of the I Foundation journey and story. Dr. Fal has just been able to comment. This is an excellent lecture. My one request Kunle, is to develop this as a module for trainers and trainees. So I hope Dr. Hassan will pick that up. I think there's a very, very good suggestion that needs to be followed up. Thank you, Dr. Fao, for that comment, man.
She's been a great motivation behind us. So definitely we take it up.
That's good to hear. So I think as part of Kunle Hassanai Foundation Academy's contribution to learning, education, and development of the eye care practice, both in Nigeria and the region, and as well as globally, that would be something to definitely work on. So in the absence of any comments or any additional questions, I would like to thank Dr. Kunle Hassan again for sharing his experience and for being part of this founder series. This is the 4th lecture in the series. I think we're going to have 10 lectures. The next one would happen in the first week of July. I think to be precise, will be 3rd of July. We will send out the notices as usual. You can listen if you have missed the previous lectures, the 1st to the 3rd. You can still watch them or listen to them via the link that have been sent with the notices for the lectures. This would also be shared with the next with information on the next lecture that would happen in about a month from now. Thank you so much for joining us, and we look forward to having you join us next month. Thank you so much, everybody. And again, thank you, Dr. Hassan, for your time.